This session is titled Professional Website Manner in Telemedicine. We're going to use a real-life application to discuss website manner and professional, courteous consultations in acute care telemedicine, video visits, and with secure messaging. My name is Bart DeMarshall. I'm a professor of neurology and one of the medical directors for Center for Connected Care, and I'm joined by my colleague,
Megan Stroll. I'm a health systems engineer in management engineering and internal consulting. So we're going to walk through how communication is key within healthcare, and there's really three forms of communication that we're going to talk about today. We're going to walk you through the scenario of an acute care interaction and then how a patient moves through a video visit and uses secure messaging when they're potentially away from the office, and then we'll follow up with any questions. So communication is key, and it's really important that the patient has a good first impression when communicating with their provider. When a provider is providing that initial communication, we want to make sure that they're compassionate and respecting the patient and the caregivers in the room. And additionally, some interactions may not be appropriate to deliver through telemedicine, and we'll walk through those different scenarios today. Recently, within the media, we saw that telemedicine had a really negative impact on a patient's encounter and how a doctor delivered through a video link that the patient was going to die. And so we really want to hone in on how that might not be the most appropriate means to deliver this type of communication. So like I stated earlier, we're going to walk through a scenario of a patient and how they initially start out with an acute care interaction, and then after they're really recovering at home and moving to a video visit. And then lastly, we'll walk through how a patient might have uncomplicated questions that would best be answered by secure messaging.
Scenario 1 is an acute care video telemedicine consultation for a stroke emergency. A 53-year-old man develops aphasia and a right hemiparesis and is brought by his family to the emergency department where there are no neurologists or neurosurgeons and no in-hospital stroke team. That hospital is part of a telestroke network and they activate a telestroke emergency. The neurologist is called upon to perform a telemedicine consultation to assess the patient and provide management instructions. This is an example of a number of time-sensitive emergencies that can be handled by telemedicine. And in these scenarios, providers have to keep in mind a number of ways in which they can optimally develop their relationship with the patient and attain and maintain rapport despite not having that physical connection to the patient and the family. There's some simple things to remember. Bear in mind that you have to verify that you're in the right hospital, the right room, and connected to the right patient. When we're with a patient in a room, we customarily check the name band, wristband, and we ask patients for their name and date of birth. There are instances with the technology that one could erroneously connect inadvertently to the wrong hospital, or that the telemedicine equipment is actually deployed in the wrong patient's room. So this is a step that should not be missed. Sometimes a provider has a very narrow field of view in a room. And so in addition to introducing themselves to the patient, the family, the other healthcare staff that are visible, they should ask if there are any other people in the room, perhaps out of their video monitor field, and ensure that they understand that person's role and responsibility. For some patients and families, this is their very first encounter to telemedicine, and it can be a daunting or intimidating experience. So even in an emergency, it's relevant to take a moment and share with the family what this video consultation is all about, to demystify it and make sure that they're comfortable with the technology and the encounter. Also reminding the patient and family that the provider is a licensed neurologist in this instance and has credentials and is on staff at that hospital, provides reassurance. This is a depiction of a typical telemedicine consultation for an emergency like stroke. You can see a provider here is at a workstation, but they may be utilizing a mobile device, a tablet, their phone, a laptop. In this case, it's a full workstation. The provider is looking at the scene, the patient, the nurse, a family member, and a physician at the bedside, and also has an opportunity to look at the diagnostic studies, in this case, a CT scan of the brain. There are a few concepts to keep in mind with video consultation to aid in ensuring that the engagement is appropriate. Sightlines is one of those things. In a busy emergency department or a critical care environment, there are many people often and many other pieces of technology and equipment. And it's not difficult to have the sight line between the telemedicine consultant and the patient be disrupted. It would be appropriate at the start of the consultation and sometimes during the consultation to remind other personnel that you need to have clear sight of the patient, if they could kindly move equipment from one side to the other, or be cognizant of where they're positioned in relationship to the sight line between you and the patient. In scenario 2, the patient with stroke has recovered after their treatment, has completed a rehabilitative course, is back in their hospital in their remote rural community, and there's an opportunity for a video follow-up from the neurologist. In this scenario, it's not a time-sensitive emergency like the last scenario, and the providers and the staff at the bedside have some more opportunity to introduce themselves and familiarize themselves with the scenario. We would advise that the provider providing the consultation, in this case again the neurologist, take the time to review the electronic record in advance, remind themselves of all the phases of critical care, emergency care, the hospitalization, if any complications occurred, and then to situate themselves appropriately. When conducting video consultations, making sure that your eyes are on the patient is important. Recognizing that when you're looking at the camera on your video monitor, you will be perceived as looking or being engaged with the patient. As you look off to the side, not so. When providers are working with patients in a physical environment face to face, and they look at something on their desk or diagnostic studies or another screen, it's apparent to the patient or the accompanying family members that the provider is doing that. In video consultations, it might look like the provider is distracted. So we commonly suggest that the neurologist, in this instance, remind the patient that they're looking to the side at a diagnostic test or looking at their desk at records so as not to appear disinterested or distracted. Making sure that you have audio and video connections that are working. Again, full introductions of yourself, the role, the responsibilities, and what one hopes to achieve during that consultation is important. Our colleague, Dr. Sarv Turkonda, and his team developed best practices for video telemedicine. And this image depicts some of the factors to consider in the room, provider's appearance, and service tips. Having an uncluttered room with a clean appearance, ensuring that the provider is centered and engaged with the patient, appropriate attire, name tag visible, are all things to set the tone of the consultation and improve the ability to have an excellent engagement and rapport. During a video consultation, it's important to build rapport with the patient and family, and maintaining good eye contact, remaining engaged, being transparent with the patient and family, having an engaging voice, and being aware of your nonverbal communications, and making sure that you're actively listening to the patient and the care team's concerns and thoughts are all tips that we would advise. At the conclusion of the video consultation, making sure the patient and family understand the diagnosis, the management plan, and there's ample time for questions to be addressed and what the next steps are. I think many of us have had poor experiences with healthcare providers when we see our healthcare provider in a room go to the door, put their hand on the doorknob as though the consultation is concluded. It's an uncomfortable sensation and adds sometimes premature closure when the patient may still have questions. In a video consultation, it's equally upsetting if there's a sudden and precipitous disruption in the video connection when the patient and family still have questions. So making sure that there are no surprises, asking the patient and family if they have any additional questions before the consultation concludes is an excellent recommendation.
Scenario 3 is secure messaging. The same stroke patient has been recovering at his home and has a few uncomplicated questions to send to his provider. So when a provider is preparing for secure messaging, they want to make sure that they ensure that they've reviewed the patient's medical record prior to sending the message, just to ensure that there's no contradicting information from other care team members. Your role in this secure messaging is to really guide the care of the patient, and you aren't wanting to formally diagnose them through the secure message. When responding to a patient, you want to make sure that the secure message is simple for them to understand and really mitigate using medical jargon throughout. And lastly, you want to personalize the message so that it doesn't sound robotic in your response and patients are seen as a person rather than just communicating electronically. However, there are certain circumstances where secure messaging might not be the right means to respond to a patient. So, oftentimes, patients might have a complex question that's going to have a complex response. Secure messaging isn't the right means to communicate this. So, we want to make sure you either call the patient or maybe request them to set up an appointment. Additionally, if a patient seems to be messaging you multiple times about the same situation, they may not understand the response that you're giving them, or it again is just too complex. And so an appointment might be right for this situation as well. And lastly, we don't want to communicate bad news or sensitive information over secure messaging. We want to be able to empathize with the patient. So really a in-person communication or a phone call would be suited best for this type of scenario.
In summary, we've presented website manner across acute care telemedicine, video consultations, and secure messaging. It's important to never lose sight of the most important attributes of the provider to patient engagement, including professionalism, empathy, trust, compassion, and building rapport. These are even more important to instill within a digital healthcare environment than in the face-to-face interactions.